Hello, my name is Emily Boucher, and I am in the Masters of Nursing in Education program. This is actually the start of my second year, so that's exciting. We're halfway through. I've been a nurse for 4 years now at Hartford Hospital's inpatient oncology unit. I'm actually one of the clinical leaders on the unit, and so each of us has a different quality improvement area that we focus on. So mine is on central line associated bloodstream infections, or CLABSIs, and catheter associated urinary tract infections, or CAUTIs. And I've actually done some quality improvement projects with my nurse manager and nurse educator in these areas already. So I do have a little bit of experience doing these types of projects, so that is nice. So for this project, specifically for this class, I have decided to focus on chemotherapy education. So for some background, chemotherapy drugs are cytotoxic, hazardous medications. They're excreted from the body through all the body fluids. So things like urine, feces, vomit, everything. This happens while patients are actively getting the drug, as well as for 48 hours after their last dose. So it's really important that these patients know what precautions to use when taking these medications so they can protect their loved ones and their caregivers and not expose them to these medications. Studies have actually shown that they have found detectable amounts of these drugs in the bloodstream of caretakers for these patients and loved ones. And exposure to these drugs can lead to things like fertility problems, birth defects, blood cancers, etc. So it's really important that these patients are, as well as their family members, are educated on the chemotherapy drugs they're receiving, as well as any safety precautions they need to follow in regards to these specific medications, these chemotherapy precautions they should be following so that they don't expose their loved ones, and just general self-care tips while receiving chemotherapy. So a big part of educating patients on a big part of this education as well is actually educating patients on their, what we call their NUR, which is when their blood counts are the lowest after receiving the chemotherapy, and also infection prevention strategies to follow, because this is typically when they're at the highest risk of infection. And we have had patients that we send home after their chemo and they end up back in the hospital a week later because they have some sort of infection, or somebody in the outpatient setting, same thing, they receive their chemo and then a week later they end up admitted to the inpatient unit with some sort of infection that potentially could have been avoided if they were following these infection prevention strategies. So I decided to focus on this for my project because I was talking to some of my coworkers and my patients. Actually, I realized that we weren't all educating our patients the same way or on the same topics, and there were some patients that weren't even talking to their patients at all, specifically about chemotherapy precautions, because we typically always talk about the drugs, but we don't always talk about precautions to follow. And on the inpatient unit, our patients are often discharged on oral chemotherapy agents, or they're discharged the day after they complete their IV chemo. A lot of our patients will receive their first cycle with us and then finish the following cycles in the outpatient setting, or they could even be going home on a continuous infusion pump. So it's really important for them to know these precautions, because they're either having chemotherapy in the home, or they will actively be excreting these medications from their body system while they're at home. So it's important for them to know so they can keep their loved ones and caregivers safe. So my project is focused on measuring the nurses' comfort level with providing chemotherapy education to our patients. So I've already sent out the pre-implementation survey. So I'm asking questions like the nurse's experience both just being a nurse, their experience with chemotherapy, how they educate their patients, what they talk about to identify any gaps there may be in teaching. Also asking about barriers to educating patients, like staffing, time constraints, things like that, to try to see maybe how in the future, even after this project is done, kind of give some recommendations on how we can make this more of a priority for our day-to-day workload, and also just maybe giving strategies on how to make this so it's not such a time-consuming process and make it a little bit easier for the nurses. And then how I am measuring the comfort level of the nurses in being able to give this education. I'm using a Likert scale from 1 to 5, measuring their comfort level. So with 1 being very uncomfortable and 5 being very uncomfortable and 5 being very comfortable. So then in the next week, my plan going forward is sometime in the next week, I'm going to be sending out staff education on chemotherapy education. And then after that, a few weeks after that, I will be sending out the post survey, once again, asking about the comfort level, to then kind of see, hopefully the comfort level jumps up a little bit. That's the goal. So I am really looking forward to completing this project, and also learning more about everyone's projects and seeing all of our results.